Heart Month may nearly be over, but the need to take care of your heart should be a priority 365 days a year.
That's right. And taking preventative steps and reacting properly in an emergency are both really critical.
So here to tell us more about what we need to know are cardiologist Nosheen Javed and cardiac surgeon Jacob Kriegel of South Coast Health. Thank you both for being here.
Thank you for having us.
Dr. Javed, we're going to start with you here. What are some things that people can do to take care of their heart at home?
Heart disease is the #1 killer in the United States, and it's really important that we take steps to prevent ourselves from catching heart disease. Some of the things that we can do is making sure that we adopt a healthy lifestyle, making sure that we eat healthy, more plant-based food, we exercise regularly, making sure we maintain a healthy weight, avoiding smoking, and then visiting doctors regularly so that they can keep an eye on all the risk factors that can lead towards heart disease are some of the things we can do.
Dr. Javed, staying with you for a second, what cardiac emergencies should individuals be aware of? What are some of the warning signs they can seek when thinking about seeking for medical care?
So some of the most important cardiac emergencies are obviously heart attack and stroke, right? So making sure that if people are having any signs or symptoms of heart attack, such as having chest discomfort, shortness of breath, breaking out into profuse sweat, nausea, vomiting, those are the kinds of symptoms that should prompt someone to call 911. Do not get into a car or ask your family member to drive you. Call 911, because that's when we see people having cardiac arrest on their way to the hospital. Similarly, watching out for signs such as weakness in arms or legs, or slurring your speech, or having a moment where you just cannot recall anything and that is just not going away, something we call transient global amnesia. Those are some of the things that when you have something like that, you should call 911.
Absolutely. And Dr. Kriegel, when is it that someone should consider going to see a cardiac surgeon? At what point does it become tap in the medical pros?
Right. So people typically see a cardiac surgeon when they have heart conditions that are no longer able to be managed with medications or with simpler interventions. And so most commonly that's, blocked coronary arteries, problems with your valves, so whether they're leaking or becoming restricted, aneurysms of the aorta, so that's a stretching or a dilating of the main blood vessel leaving the heart. And then finally, what we call advanced heart failure, when the heart itself is really too weak to effectively pump blood throughout the body. And so the most common operations I do are coronary bypass grafting to treat blood around those blockages, valve repair and replacement, repairing those dilated aortic aneurysms, and then finally treating heart failure with devices and procedures that can help improve the ability of the heart to pump.
When you hear about cardiac surgery, up from jump, it's naturally intimidating for people, but over the years, what kind of evolution have you seen from cardiac surgery for the community specifically?
Yeah, cardiac surgery and cardiac treatment in general has just evolved tremendously over the last few years and decades. And the trend is really towards less invasive approaches. We're able to do incredibly complex procedures through small incisions, sometimes through no incisions at all. And all that translates to better outcomes for patients, safer procedures, quicker recoveries, shorter time in the hospital. And really the name of the game is getting people back to their lives feeling good. And the ability to do that is only increasing. And we're able to do that every day, which is great.
Well, thank you both for your time. We appreciate it. And for more information, just go to southcoast.org.